Joining me now to discuss the spike in COVID-19 infection in the last 1 week is the PRO of the Association of Public Health Physicians of Nigeria, Dr. Blossom Madufokwa. Thank you, Doctor, for joining us. We're told now that the number of cases rose from 392 just 2 weeks ago to 693 last week. That's between July 5 and July 11. Talk to us about the implication of this data. What is this latest data telling us relative to our experience at the onslaught of the first wave?
Thank you so much for having me. Good evening. So you're asking the question that everyone is asking, what is happening? We thought we were completely done with this pandemic, and then all of a sudden we're seeing all these cases. So now this is basically what really a lot of us were expecting to happen, because initially we had started to see these waves in other countries. So usually what happens is you start to see these waves in other countries, and with the opening of borders, people are traveling, international travel all over the world, even cruises have even commenced. So when these things start to happen, you already know that at some point it's going to get to your own border. You do everything within your power to make sure that you keep this from happening, but we know from experience that this is exactly what happens when we open our borders, when we don't wear our face coverings, we don't ensure that we avoid crowds. So we give this virus an opportunity to continue to persist within our communities, and the longer the virus persists in our communities, the more the virus will begin to change its character. So that's what we're getting all the variants, and now we have a new variant, the Delta variant, that everyone is going on and on about. It's more transmissible, so it's not really a shocker that we're seeing a spike in the number of cases.
Indeed, Dr. Blossom, you agree with me that it's a difficult task now ensuring that we adhere to all the non-pharmaceutical protocol, given the fact that we're getting our lives back. The stadiums are full again, event centers are back in business. How daunting a challenge do you think we really have ahead of us in getting people to comply yet again?
It's really a challenge. Honestly, I'm going to be very honest with you. It's a huge challenge. I can tell you from my own personal experience, I actually had to, at some point, walk the streets of Oshodi. I'm going to be honest with you. Walk the streets of Oshodi, trying to convince people even to come and get vaccinated. And the message we're getting on the ground, you will not believe this. People were saying, oh, COVID-19 is gone. People were saying COVID-19 is for people that live in Lekki, Ikoyi, and VI. It's not for us. It doesn't affect us. It's for the rich. And it's so, in fact, people were actually asking us why we were wearing our nose masks and our face coverings. People were like, take off your nose mask. There's no COVID going on. Yeah. So it's really a challenge to get people to comply. But I believe that with community participation and engagement, we need to engage people at the grassroots. We can speak to people like on TV and on radio, on the radio, but we need to get to the grassroots where the people actually live.
But what would you say we have learned from our experience last year? One would assume that based on the experience we had from Lagos, which is the epicenter, and indeed across the country, that Nigeria would now be better prepared for the third wave when we talk about, for instance, health infrastructure and the technical know-how. How better prepared are we for this third wave?
So I see what you're saying about preparedness. And yes, we have set up certain structures. We have isolation centers. We, the healthcare professionals, were better able to manage cases when we see them. But there's a particular variable that we're not taking into account, and that is fatigue. People are basically tired of wearing their face coverings, tired of avoiding crowds, tired of not attending events that we would like to attend, tired of constantly washing their hands and using hand sanitizers. So because people are exhausted with these protocols, people have become lax, and that's why we're seeing the spread that we're seeing right now. Added to the fact that we know that last year, for most of last year, schools were closed, but now schools are open, children are back in school, mingling, mixing, bringing infections back home. So these are some of the factors that, yes, we're more prepared in terms of the system, in terms of clinically being able to manage our patients. But the problem at the core of this pandemic is human behavior. So when it comes to human behavior, people are just basically tired of doing these things that we've preached since the beginning of the pandemic. And people are just saying, since it's not really killing most of us, I'm just going to go about my business.
Particularly now that some have had the complete jab of the coronavirus vaccine, not many people care about the third wave after all. We'll talk more perhaps subsequently on some of the medical reports we're hearing about this new variant. Dr. Blossom Madufokwa is the PRO of the Association of the Public Health Physicians of Nigeria. Thank you for talking to us.
Thank you so much for having me. Have a good evening.